injected. Carefully in selection. If you have an already irritated or an inflamed skin, avoid that. We know that facial skin is different from other body areas. The facial skin is very thin to extremely thin. People who are on topical vitamin A preparations, their skin is even thinner, might bruise a little bit easier. If you use an alcohol swab, you might have some redness that is persisting. You think might be a problem with the filler that you injected, but not. And so this is and also so people with so in certain areas like eyes, like the nose, lips, they are very sensitive. So you need to assess that area. Also, people who have previous procedures who got injected before, they got laser, skin tightening, look again that this is more prone to develop an infection, more prone to develop, to disrupt the barrier so that germs can enter. Also, pre-existing conditions, they are known and we need to assess them up front. Second, prepare yourself. You must have your equipment at hand and ready, a clean clinical environment, appropriate clothes. So we know that the area around the wrist of injectors is the most contaminated area. So therefore, a watch, don't wear watches, don't wear arm bracelets, and so for female injectors, because that is an area that might get into contact with the patient, so you might easily transfer bacteria to those areas. Wash your hands up front. Also, wash the hands of the patient. We will say that a little bit later. If you want them to hold a gauze, to take something, if you inject at some point and you go to another area, keep the hand of the patient there. Well, you want that hand to be clean and disinfected. And gloves. I put here sterile gloves. That is not absolutely important, but definitely gloves that are protecting the patient from your hands. Sterile field instruction, but not touching the face. How many times have you seen the patient say, "Oh, okay, you do something here," and they have a nail which is not completely clean, and they put on something. So in an area that you just cleansed, that is something that you need to tell the patient, stay away from your face. The only one who is touching the face during the procedure is me. Aseptic preparation of the treatment site, remove the makeup and the hairband, and I'll show you in the next slide why removing the makeup is important. Degreasing and cleansing, where there are numerous products all over, you use whatever you think that you find appropriate. I'm very much in favor of chlorhexidine to do disinfection. I use that in a 0.05 to 0.1 in an alcoholic solution here. Let's go to the reason why makeup removal is important. If you have makeup and you stab with a needle, you inject with a needle through that, you might introduce particles of makeup, particles of carbon, for instance, or other makeup elements that you get into the skin, and then first of all they're not sterile, and secondly you might cause an iatrogenic foreign body reaction by not removing this up front. Sterile fields or no touch, we dealt already with this. Change a needle and a cannula regularly. When I do bolus technique in a face and I take a 3-point bolus, for instance, I will change my needle every time. That is not because I like the company who is producing the needles, but definitely not. But it reduces my possibility of introducing germs again by by going with the needle again through another area of the skin. If I take a sterile needle again, I will reduce that risk dramatically. So this is something that I recommend absolutely. Good. The next point here is in the aseptic technique. Okay, we change a little bit from before and during and after, but this is important in the aseptic technique issue and that we deal with now. Minimize touching. So of the injection sites, I always tell them there is a 2-week period after the implant placement where bacterial contamination can occur more easily, and biofilm formation can occur more easily. You can understand, you have been poking around in tissue, so you create a little wound, a little bit bleeding. There is some edema cells around. So if you go and that takes a little bit of time to be to be resolved. So if you go back into that area very quickly, a week later, 2 weeks later, you might. So it's a facilitating condition for bacteria to grow in such a condition. Also, and I told this to many of you already before, dental procedures, facial trauma, facial infection, they introduce bacteria and induce biofilm formation. So, as a rule of thumb, when people you just implanted bolus technique or of a deep filler or something like that, and they have a dental abscess the week after, please get them on antibiotics to reduce the possibility of having an infection of your implant. Post-injection patient instructions, I always say avoid the makeup for 24 hours. If they need to resume their activities right away, I tell them, yes, you can do this, but then take a new tube, a new canister of makeup, not something that has been lingering around in a purse for months, and where the brush has been in places that I don't want to know where that brush has been already. So also follow up in early stage if you see signs of adverse events. That is very important here. For follow-up, there are clinical guidelines. So American Society for Dermatologic Surgery has guidelines. We prepared with a group of injectors from Europe and a little bit beyond Europe as well. Some guidelines that will be available or are available already now, and I think that representatives of Allergan can help you with them already now. So this was before the procedure. The main point, assess. So I repeat, assess pre-existing conditions, also pre-existing skin condition, and take care of very, very precise aseptic conditions. Now, during the procedure, the first and the most fearsome issue is the vascular compromise. Vascular compromise with inducing necrosis with possibility of embolism. This is of paramount importance here during the procedure. This is the issue to fear most of all. So symptoms, the first symptom is pain. You can have some local skin pallor, signs of blocked flow if you are in a venous area, for instance, and also, and this unfortunately has already happened at this moment, not with HA, but with other components, and the unilateral loss of sight has been described yet. If you have this, if you encounter, and if you see that there is, if the patient tells you, oh, I have really a very intense pain, or you see that the area that you have been injecting gets completely white, and even with a lesser extent pain, that is an alarm sign, that must be an alarm sign at all points. Stop injecting immediately, and then do everything you can to restore the arterial flow. Heat, definitely not cold. I've seen this already, but ice packs are put on it. That is exactly what you don't need to do. This is exactly the opposite. So heat, massage, nitroglycerin paste in countries where you can have that, and then low molecular heparin. That is something right away. And then, of course, if there is a product that has been injected, try to dissolve, try to eliminate that product. Hyaluronidase, in some countries it's not available, but in a huge number of countries this is available. This is something that needs to be done, and repeatedly, and I'll show you in the publication why this is important to repeat and to continue doing this. But that of course is of less importance. If collagen has been used, there are collagenases also that can be used to dissolve and eliminate the injected product. From a very good paper from a group of Kim in Korea, so they showed that if you continue injecting hyaluronidase after you got a vascular compromise, it can still help in reducing the extent of the necrosis and inducing a quicker and a faster and a more in-depth healing of that tissue, of potential tissue necrosis. So the bottom line is, if you start using hyaluronidase, continue using the hyaluronidase for a long period of time. So as I put this in the first slide here, continue to use this. It is extremely important. And I have a nice case to show you this. This was a case that was sent to me by a good friend of mine, Alexander Turkevich from Ukraine. So this was a case of a patient, and you can see 20 minutes post-injection in the nasolabial fold. And look at this area. You see blanching here, and you see that the very, very alarming condition of the skin. 1 day post-injection, even more distinct, you see it already demarcated. Then here, 2 days post-injection, so they started the hyaluronidase here, and you can immediately see in this part here where a part of the arterial flow has been blocked. He has very good documentation of this case. This was 2 weeks later. 2 weeks later, there was already necrosis and infection. In the slide that I will go back to you, I will show you, if you see blisters and pustules, this is an absolute indication that there is necrosis that's going to be that's going to be seen. So, and you can see already this is happening. So this was 2 weeks later. Then 3 weeks later, so you see this is scar formation. So you can understand this is a really disastrous condition after a patient who has been injected for something to have a more enhanced aspect of the face, and then they end up with something like this, which is very